So I welcome you all to today's session. Myself Rajita, and in this session, we're going to continue the discussion about anemia. So, as like previous sessions, we have learned about the anemias. We have seen different kind of this disease. Like we have seen the iron deficiency anemia, we have seen the megaloblastic anemia, which is basically caused because of the deficiency of the cobalamin and folic acid. So today we are going to discuss this anemia, which are generally caused because of blood loss. Now, as we know, anemia can be having varieties of reason behind the development of it. So if an individual is having a continuous bleeding or acute and chronic blood loss, these individuals are having high risk to develop anemia, because you need to get the idea that they are losing their circulating blood from inside. So often in this kind of condition or in this kind of situation, we are going to see the blood loss will be whole. So all the blood products will be losing from the person's body. That is when a person will be showing the clinical sign and symptoms if this blood loss is not managed and the replacement of the blood product and fluid has not been done. So in this session, we're going to have a discussion in detail regarding anemia, which will be occurring because of the blood loss, or we can say anemia caused by blood loss, what it is, how the acute and chronic blood loss can cause the anemia development, the clinical manifestation, diagnostic studies, as well as the collaborative management to manage this condition of anemia. So anemia caused by blood loss. It is a clinical condition where, due to the acute and chronic blood loss, a person may develop a state of anemia where they will be losing their whole blood component, even they will be going for fluid electrolyte imbalance. That is when a person will be showing the clinical manifestations associated with anemia, and we are going to call this condition as anemia related to the blood loss. So we are going to first have the discussion how the acute blood loss is related to the development of anemia, or what are the conditions which can cause acute blood loss for an individual patient. So acute blood loss occurs as a result of a sudden hemorrhage. So in a situation, for example, if a client have a traumatic injury, we often know if the injury is very severe, a person will start having bleeding. Now, in case of severe traumatic injury, definitely the blood loss will be very much high amount, which if it is not controlled, managed, and replaced, a person may go into the anemic state. So the causes behind the acute blood loss includes traumatic injury, as I have mentioned. So generally we are going to see if the traumatic injury is severe enough, which is causing a very severe amount of blood loss, that time only the person may go for the development of anemia. The next is complication of surgery. So if a client or a patient is going for any surgery, and if the person is having any complication like bleeding related complication into the surgical part or surgical area, so definitely we're going to see a person may go for anemia if it is not managed and if the blood product and fluids are not replaced. Now, there are also certain conditions which cause interruption into the vascular integrity within the body system. So, in such cases where it is directing or it is causing a disruption in the vascular integrity, a person may have internal bleeding. Due to that, a person may be going for an anemic state development. Now, in case of acute blood loss, we're going to see a client in such condition may have two major clinical concerns. Now, these two major clinical concerns include, the first one is the sudden reduction in the total volume of blood, which may cause a development of hypovolemic shock immediately. Now, the second one is if the acute loss or acute blood loss is more gradual, we're going to see the body will be maintaining the blood volume by slowly increasing the plasma volume inside it. So here, although the circulating fluid volume will be preserved, but as the body is trying to compensate the condition, we're going to see the client will be having a increased amount of fluid in order to manage the fluid volume deficit. In this cases, often we're going to see a client will be having excessively diminished number of red blood cell, because you need to understand, if a person is having a acute bleeding which is occurring or which is increasing gradually, our body will be trying to increase the plasma volume to compensate the acute bleeding. But in the other side, here only the plasma volume is increased. The RBCs or the red blood cells will be definitely having diminishing count into the circulation. That is the reason why in the gradual state also a person may likely to suffer from anemia. So now we're going to discuss what are the clinical manifestations generally we are going to see among those clients who are having anemia or who are having the chances of the development of anemia related to acute blood loss. Now, you need to make it clear before the discussion of clinical manifestation that all the signs and symptoms, whatever is developed within a human body because of the acute blood loss, will be definitely a result of the compensatory mechanism which body will be initiating to manage the blood fluid volume, as well as to manage excess or to manage the adequate oxygen carrying capacity within the body tissues. So that is the main target of the body compensation, which will be directed once a person is having acute blood loss. Now, that is the reason, due to this compensatory mechanism, we will be seeing among those clients that they will be appearing with very slow and gradual signs and symptoms of anemia. Now, it is very essential to understand in this case of anemia that the clinical sign and symptoms here plays a very important role compared to the laboratory values in order to promote or in order to administer the treatment. So basically, it means that if a client is having acute blood loss, the first focus should be managing their sign and symptoms compared to focus on the laboratory values. Because in some cases, we are going to see the laboratory values won't show a proper exact number of acute blood loss in the initial phase due to the compensatory mechanism of the body. So for example, suppose a person is suffering from hemorrhoid. Now that particular person have lost 750 ml of blood within 30 minutes. Now for this client, they will be developed with postural hypotension. But in laboratory values, we are going to often see that the client will be having managed hematocrit and hemoglobin level. Because in initial stage, body will be compensating. That is the reason here to manage the client with a proper treatment. To look into the laboratory values is the second priority. The first priority should be provided to the sign and symptoms, and we can assess the severity through assessing the sign and symptoms whatever is present for our client who is having episodes of acute blood loss. So that's the reason here assessing of the client plays a very important role. So generally we are going to see that whatever the client is telling, or basically we will be focusing on the subjective and objective data. So assessment should be done for the expression of pain, which will be provided by the client. So often this is going to help a person to identify whether they are having an internal injury or there is any chances of the internal bleeding is present for a client. So in this cases, pain can be localized or referred pain. So for example, if a client is having retroperitoneal bleeding, often we are going to see the client may complain about symptoms of severe abdominal pain. So that is the reason here we have to be very focused on assessing the pain and all the subjective and objective data which are or which can be collected from patient. Now, in some cases, client may show the symptoms of numbness or tingling sensation over the extremities. If at all, the distal nerve branch has been compressed because of the excessive bleeding. So all the symptoms like numbness, tingling sensation, and pain, and even the discomfort should be assessed for the client properly. So now we are going to see the exact type or exact clinical manifestations which often will be present for our client for acute blood loss. So we are going to classify or we are going to read this clinical manifestation depending on the volume that has been lost from the circulation. So first we are going to see if in a clinical scenario the person is losing almost 500 ml of blood from the circulation, what are going to be the clinical manifestation for that? Now here, the clinical manifestations generally are very rare. So in almost all cases, person with 500 ml of blood loss will be having no absolute sign and symptoms. Rarely, they can be developed vasovagal syncope. Other than that, a person would not show any clinical sign and symptoms. The next we're going to discuss if in a clinical scenario a client is losing 1000 ml of blood. Here basically no detectable sign would be seen among the client if they're in a complete resting phase. But if the client is performing certain exercise or activity of daily living, maybe the person will be complaining about tachycardia. Even there can be presence of slight postural hypotension. That is the most common clinical manifestation seen among the client after almost losing 1000 ml of blood. In case of 1500 ml of blood loss, often the client will be present with postural hypotension and certain discomfort. Even they can show the feature of syncope very prominently. In case of 2000 ml of blood loss, often we're going to see the blood pressure, the central venous pressure, and the cardiac output always will be showing the below level at rest than a normal level. So often the person will be complaining about air hunger, rapid and 3D pulse, even a cold and clammy extremities. That is how we are going to see this 2000 ml of blood loss if a client is having that. They will be showing the feature very prominently, and immediate treatment and management should be administered to save the client. So if a client is losing more than 2500 ml of blood, we are going to see they can develop with lactic acidosis. Even there can be presence of shock and potential death can occur. So I hope you are now completely clear regarding all the data which has been given. Now, definitely the clinical manifestation can vary depending on the patient physiological state, depending on the reason behind the bleeding, and also it depends on the client's body's compensatory mechanism or presence of any underlying disease condition. But almost in all cases, whatever we have mentioned, that for this much amount of volume of blood loss, the general sign and symptoms development we have discussed here. So I hope now you're completely clear. Now this would be basically a suggestion or basically an indicator that the person are having threatening of life. So immediate management and blood replacement should be initiated at earliest to manage the complication. Now, as we have learned the clinical manifestations, we're going to discuss here about the diagnostic studies. So when the blood loss will be so accurate and so sudden, definitely the plasma volume has not yet been increased or decreased, right? So here we are going to see no changes in the laboratory values preferably. Now, once after 2-3 days, the laboratory findings would be completely different in case of acute and sudden blood loss. 3 days, as we know, our body's compensatory mechanism will try to increase the plasma volume level, and that is when we're going to see the RBCs will be diminished, or the number of RBCs will be decreased here. So at this time, the red blood cell, the hematocrit, even the hemoglobin level will be showing a decreased level in the circulation, which is an indication that the person was having episodes of acute blood loss. So I hope you have completely understood the scenario of acute blood loss, how it's going to be. So sometimes a person will be having external bleeding, which will be visible enough. So once the bleeding is visible, it is very urgent to stop the bleeding and manage and replace the blood loss. The next part, in case of internal bleeding. Now, as I have mentioned, often with internal bleeding, a person will show the feature of pain and other clinical manifestation like numbness and tingling sensation of the extremities, the syncope, even the pressure disbalance or inadequate blood pressure, or we can say alteration in the blood pressure. So that is when a person should be screened well, and immediate management and treatment should be administered by assessing the need of the blood transfusion or blood replacement, and also by assessing the rationale behind the internal bleeding. That is how here we are going to manage the blood loss first, so that as a complication the anemia should not happen for the client. So now here we're going to discuss regarding the collaborative management of blood loss related anemia. So you need to make it very clear that rather than focusing on anemia here, we will be focusing on the blood loss, because you need to understand the reason behind the development of anemia is the blood loss. So once we are finding out the reason of the blood loss, we are stopping it and managing. And if at all the person has loses a adequate amount of blood, if we are replacing that, the person would not have any chances of the complication development related to anemia. Even a person may not show the signs and symptoms associated with it, because it is a complete reversible condition if the blood loss is not so much. So the collaborative management here basically focused replacing the blood volume via transfusion to prevent the shock development for the client. So that is the reason it is a very important part to replace the blood and fluid volume at immediately as possible, if at all the client is having any sign and symptoms related to the blood loss or fluid electrolyte imbalance. The next focus of the collaborative management includes identifying the source of hemorrhage and stopping the blood loss. Now, this point or this part of the collaborative management is a very important option, or is a very important step, because here we are going to treat the underlying cause and we are going to stop the bleeding, so the anemic state, even if it has been already developed, will be reversed. So generally, we are going to see the third focus of collaborative management will be providing or administering intravenous infusion or intravenous administration of fluid. Now here, generally, we are going to use the solution like dextran solution, crystalloid electrolyte solution. Even we are going to replace albumin sometime in order to stop leakage of blood within the periphery. Now, lactate ringer solution as a crystalloid electrolyte solution would be preferably used in case of acute blood loss. So the amount of this solution will be depending on what kind of solutes or solution is being used for the fluid replacement. So depending on the client stage, depending on the bleeding and the sign and symptoms or severity of the sign and symptoms. We are gonna decide the amount and the type of blood supplementations or the fluid supplementations which should be administered via intravenous line. Now, once the volume is replaced here, the next attention of the collaborative management should be focusing on the replacement of red blood cell. So, as we know, the volume replacement plays a very important role to prevent the hypovolemic shock development. Once the volume is replaced, next focus we will be providing to replace the lost red blood cell for the particular client. So as we know, the body at least need 2 to 5 days to manufacture more amount of red blood cells with increased erythropoietin. That is the reason here to manage or to balance the red blood cell amount, it is a very important part to initiate a blood transfusion depending on the amount of blood loss. So if the bleeding is because of the or related to the platelet and other clotting factors or clotting disorders, definitely the replacement would be done for the needed component to manage the condition of the client. Now here client may require administration of supplemental iron, as the availability of the iron also sometimes will be affecting the marrow in case of the production of erythrocytes. That is the reason the supplemental iron should definitely be used here after the replacement of the blood, if at all it is indicated. So generally, if the anemia already have developed related to the acute blood loss, oral or dietary iron supplementation would not be very sufficient enough to manage the amount or level of iron in the body. That is the reason here the supplemental iron administration should be done as soon as possible, if at all it is indicated for the particular client. So generally, we are going to see the parenteral iron administration would be done by the medical professionals for the client. So I hope now you have got a complete idea and clear picture how does it looks like to have or to develop anemia related to the acute blood loss. What are the factors will be affecting generally, and also we have seen the diagnostic studies, the method to do it, and the basic treatment procedure. Now we're going to discuss about the nursing management of acute blood loss related anemia or chronic blood loss related anemia. So the nursing management basically includes assessing the client. So history collection and physical examination would be definitely done, but in case of an emergent scenario, we're going to see or we're going to assess the area or localized area where actually the traumatic injury has happened. Or basically we can say the first priority would be searching or sourcing and pointing out the source of bleeding or hemorrhage. So the next one is definitely stoppage of the bleeding source. That is the second priority of the nursing management. So in case of post-operative client, that is the reason here nurses plays a very important role to monitor the client at a regular interval. So even all the drainage tube dressings should be checked at a regular interval to find out whether the client is having excessive bleeding or not. So nursing role here basically would suggest that if at all there is any bleeding, we should definitely try to reduce the chances of bleeding. So because of that, we need to assess the localized area where the bleeding is coming from. So in such cases, we may provide some external pressure to control the bleeding. Almost always, if a client has undergone a post-operative phase or a client has undergone a surgery, we may change the suture and we may put appropriate suture if at all it is indicated. In case of traumatic injury, definitely external pressure and even a suturing would be done to control the bleeding from the source. The next role definitely includes replacement of the blood product. So generally, as prescribed by the physician, we would be replacing the blood product, whatever has been lost from the circulation from a particular individual. Fluid volume here also would be corrected by administration or by administering of different type of intravenous solution, whichever is indicated. So no long-term treatment would be preferred here to manage the anemic state. So I hope you are now completely clear that here basically the nurse's role would be focusing to stop and manage the bleeding as well as to replace the lost blood volume. Now, as we have learned the concept of acute blood loss related anemia, now here we're going to definitely learn about the chronic blood loss. So, as the name itself is suggesting, you need to understand the chronic blood loss almost always will be related to certain underlying disease and disorder. Now, generally, the sources of chronic blood loss are similar to those with iron deficiency anemia, most preferably. Often, we're going to see the client who are present with bleeding ulcers, hemorrhoids, may complain about a chronic episodes of blood loss. Even the high risk group will be considered as the teenage menstruating girls also. Post menstruation bleeding also can be a cause of chronic blood loss. Now, in such cases where we are going to see a client is having a chronic blood loss, sometimes or in certain times where the body is not able to compensate the blood loss or the bleeding, we are going to see the client may develop a state of anemia. Most commonly, we're going to see with chronic blood loss, if a client is not maintaining a lifestyle, a dietary intaking of supplementation, they are more prone to develop the anemic state. So most commonly, the chronic blood loss usually will be related to the iron deficiency. That is the reason the chronic blood loss related anemia often would be having all the features related to the iron deficiency anemia for a particular individual. So the management of chronic blood loss related anemia would be definitely identifying the source of bleeding and managing and stopping the blood loss from the particular patient. Now, supplementation, iron or needed supplementation plays here a very vital role. So, as a medical professional, it is our responsibility to educate the client regarding the disease condition and nature of it. We should make them understand why it is very important to follow a regular health checkup, to follow a very healthy dietary intake, which is more contain or which is contain more amount of iron, even why it is very important to continue the iron supplementation and other supplementation even if it is indicated. So that is how we're going to manage the client with chronic blood loss. So I hope in this whole session we have learned about the acute and chronic blood loss related anemia and its management in details. So you need to very surely make it clear that the anemia related to the blood loss, here medical professionals first and priority will be focusing on managing the bleeding or the disorders or disease which is underlying or which is the main cause of the bleeding. Managing that would be definitely helps an individual to stop or to prevent with the development of anemia or any complication associated with it. So I hope you have enjoyed the session and you understood the concept. Thank you so much for attending the session. We will be meeting you guys into the next session with the different types of anemia and its discussion.